Okay, thank you, Jay. Hello, and thank you for being here. I want to start by acknowledging that I'm joining you from Treaty 6 territory in the homeland of the Métis. And I'm here to speak up for Saskatchewan's 13,500 teachers and the students that they teach every day, to share their concerns and the issues they're facing in schools and classrooms, and to implore the minister to slow the unnecessary and preventable spread of COVID-19 in schools. The lack of coordination and consistency in the province's pandemic response is being felt on the front lines of our education system, in our classrooms, by teachers, school staff, and parents. With each passing day, teachers are more fearful for the health of their students, especially those too young to be vaccinated. Currently, 1/3 of Saskatchewan's COVID-19 cases are in children under 12 years old who are not yet eligible for vaccination. This is disproportionately high, as they only make up 15% of our population. During the worst of this fourth wave, while our healthcare system is in crisis and our schools are being impacted by record numbers, we need every measure available to us to protect students, young children, and school staff. Based on previous waves of COVID-19, we know the measures that are effective to slow transmission. What we need is for leadership to implement these measures clearly and consistently across the province. Each day, teachers share their experiences with me. I would like to share a few of the messages that we've received in recent weeks. One teacher writes, 3 classes have been affected by COVID, but none have moved to online learning, nor has an outbreak been declared. There are medically vulnerable children in our school, and I also worry for them and their families. Another stated, the stress, exhaustion, and frustration is at a level I have never experienced before. This is not sustainable. And a third spoke about their concerns with inconsistent practices, stating, we are working in crowded conditions, initially without mask mandates and with COVID sick days removed from our options for leave. This is contrary to our understanding that if someone is ill, they should stay at home. The messaging is mixed, and teachers have learned that the unspoken message is stronger than the spoken one. These teachers deserve better. Students and families deserve better. Minister Duncan and Premier Moe have a responsibility to ensure the safety of students while in our schools. I urge them to demonstrate the leadership required of their roles and implement consistent, logical measures to keep students and our communities safe. Transmission is occurring in schools, and it won't get better by doing nothing. I've shared a letter with Minister Duncan highlighting the concerns our members have raised. Among these, I want to highlight a number of key concerns. Breakthrough cases in vaccinated school staff due to in-school transmission, as confirmed by public health officials. Inconsistent approaches to declaring outbreaks and isolation requirements for close contacts. Teachers, principals, and vice principals taking on the role of contact tracers, spending their evenings notifying parents of classroom cases. And school case counts are inaccurate and incomplete. In response to this crisis, we need open communication and collaboration across the education sector. That could start by reinstating the education sector response planning team, as we have been calling on Government of Saskatchewan to do since September 21st. Vaccination policies and mask mandates are critical layers of protection at this time, and we applaud the implementation of these measures. But we also need consistency, transparency, and clear messaging from leadership if we're going to change our current trajectory and properly support children and adults gathering in our classrooms each day. The Federation stands ready to work alongside government and our sector partners to implement a logical, science-based, proactive plan to keep students, members, and school communities safe. And so specifically, we're calling on a few things. As I mentioned earlier, open communication and collaboration across the education sector. This isn't happening currently. To that end, a good first step would be reinstating the education sector response planning team, or the RPT. The next step, vaccination policies and mask mandates are critical layers of protection. And while they should have been implemented much earlier, we applaud their eventual implementation of those measures, but we also need consistency, transparency, and clear message from leadership in order to make our schools safer. And that means that all students deemed as close contacts should be required to isolate at home. We need to boost up contact tracing in our schools so that there aren't significant delays which cause situations of students receiving letters telling them to isolate after the required isolation period has already expired. As mentioned, principals, vice principals, and teachers should not be required to conduct contact tracing in an already overstressed education system. And we call on the government to limit group sizes in our communities. Our schools are tightly interwoven with the communities in which they operate, and limiting group sizes will go a long way to reducing the spread of COVID and the variants. So with that, I'm happy to answer any questions that media might have. And so just feel free to indicate if you've got a question. And I'll try to keep track on the line here.
So if you would like to raise your hand, I can let Patrick know when someone has raised their hand, and we can we'll call on you to speak. Okay, so Lynn.
Hi, Pat. So I guess out of this announcement, you've specifically called for gathering restrictions in the community. But what specifically would you want to see happen in schools? Like, are there more measures that you want impacting kids in classrooms tomorrow to see slow that spread in schools?
Yeah, absolutely. That would start with the reinstating the response planning team, which gives education sector partners some time to look at the data that's being presented by health, take recommendations from health officials, and have proper communication in order to plan for the sector. Specifically, to make things better for tomorrow, we would need things like all students being deemed as close contacts should be required to isolate at home. There shouldn't be exemptions allowed for them. And we should also be boosting up the contact tracing and making sure that contact tracing is rigorous and effective, and that people are getting timely information to know when they need to isolate in order to keep our schools safe. We have situations where parents are reporting that they've been contacted, that a student is positive. We're not getting the message in our schools. And we're having situations where the friends of those students who we know are close contacts aren't getting letters for a week or two later. And that type of a situation is, what is allowing this virus to wreak havoc in our schools.
And Dr. Shahab said, or told media during the media briefing this morning, that in-school transmission is about 23% of school-aged children cases right now. Is that the number that you had kind of been aware of as well, or is that new to you?
Yeah, and I think, Lynn, that's part of the problem, is that we're not getting that data because the response planning team hasn't been reinstated. The business planning team was reinstated, but as far as education, we don't have eyes into, or a window into that information. And so we end up being reactive and hearing from members that they have significant concerns, hearing from in-school administrators, principals, and vice principals that they're overwhelmed and they're having to do contact tracing in the evenings and on weekends. And but we outside of anecdotal information provided from parents of students who are positive to school community members, that's the information that we have to work with. So we know that there is transmission in schools, but the problem is the health system seems so overwhelmed that we're not getting that information until in some cases weeks later.
Okay, next we have Marcia. Sorry if I pronounced that wrong.
Marcia, did you have a question? Okay, we'll come back to you. Are you there, Marcia? Okay, we'll come back to you and we'll go to Nelson, if that's all right. Nelson, is your audio working?
I believe so. Yeah. And sorry, it's Cole Davenport with
Oh,
CTP.
cool. Sorry.
Yeah. No, it's okay. Nelson signed up on my behalf. I was at another thing. So, one thing I wanted to ask you about out of this is just when you hear Dr. Shahab mentioning the transmission in schools, and one thing that's been said a lot during this pandemic is that some of these school cases are being caught at home. How much do you think that reflects the situation currently in schools?
Yeah, and I think that's part of the difficulty is that with so few restrictions on students are allowed to associate without masks at noon and after school and in their evenings and in recreational activities and sports and activities after school. So it is difficult to tell. That said, we do know that there are specific situations that health has indicated of transmission in schools. And we also know that in a few situations, there are breakthrough cases of members who have been vaccinated who have got COVID through their employment. And so there's lots of concerns about the transmission that is going on in schools. We still don't have any social distancing going on in schools. And this year, many of the protective measures that were in place last year, like cohorting, aren't being undertaken. And so it's not surprising that we're seeing more transmission in schools this year.
One other thing that the government has pointed to when the issue of transmission in schools has been brought up is the eventual approval of vaccines for kids. Obviously, that hasn't happened yet, although that is before Health Canada. What steps do you feel need to be taken as soon as possible in the meantime in order to help alleviate some of these concerns?
Well, definitely improving contact tracing so that we know when somebody has been exposed. Those who are deemed close contacts should be isolating at home. We were doing that last year and that was effective. Unfortunately, when people are finding out 10 or 15 days after they've been exposed that they need to isolate, but there's only a day or two left or no time left in the requirement, that just allows COVID to spread further in our schools. As far as vaccines being available to younger students, that's obviously going to be a positive move. The difficulty is back on August 16th, the Saskatchewan Teachers Federation executive voted in favor of a motion that all eligible staff and students be required to show proof of vaccination in order to be entering their school buildings. And so it's not saying that students would be denied an education, but that we would look at other measures, possible testing or possible education learning from home if they're not vaccinated. So that would be another thing that the government should be looking at, is making sure that everybody that's in our school buildings who are eligible for vaccination are required to be vaccinated.
Thank you.
I'll jump in with another one here if no one else will.
Sure, go ahead, Lynn. Yeah.
Okay. Dr. Shahab also said today that despite this transmission that we are seeing in schools, it's really important to keep schools open and not online because of the negative impacts of moving school online, like the impacts to students and families. What do you think of that idea, and where do you kind of draw that balance in your mind between keeping kids safe from COVID and keeping kids in school?
Yeah, absolutely. And it's a really important question. So no teachers want school to move online. No school community members want school to move online. There are some people who choose to do online learning and for a variety of reasons in their own personal life. But for the most part, people are attending school because they value that face-to-face interaction. The difficulty is, how do we do so when we're in the fourth wave of a highly transmissible variant that has already completely overwhelmed our healthcare system, and that we don't know what the full effects are in students regarding long-term COVID and with their developmental process. So we need to keep our kids safe, especially those who aren't eligible for vaccinations at this point. So everybody wants to keep schools open, but we also have, need to make sure that everybody is kept safe. And so that's the battle that we have. Like I say, I guarantee that every teacher wants face-to-face learning. And every in-school administrator, things operate more smoothly that way. But when we know that that students and members are coming to school and contracting COVID, then clearly what we're doing isn't reasonable. The other thing I would say, though, is that the number of transitions that we're currently seeing in some schools where parents are keeping their kids home because they know that the school community is not safe, and a few parents are having to send their kids due to work commitments, but we end up with this kind of hybrid model of half or less of students actually in this classroom for face-to-face learning, and then parents expecting work packages or some form of help online from teachers as well. And so the actual quality of education is suffering in the current model as COVID is kind of wreaking havoc through our schools. So we need to make a decision. Do we want to end COVID, or do we want to keep schools open at all costs? And unfortunately, the way we're going now with the transmission that's occurring in school, is it going to be a point where somebody gets really sick and is hospitalized? And of course, we know what that means with our healthcare system at the state that it's in right now. So we want to make sure that everybody is safe and that we come out on the other side of this pandemic with everybody healthy. So it's a constant battle, and we face that right across the country. And I was just in a meeting this morning of an international level where that's a concern. We want school to be face-to-face, but we also need to keep people safe. Sorry, I think that was a bit of a long answer, Lynn, but I hope.
No, it was a good one. Do you think, would you want to see schools move online then because of the transmission you're seeing, or what threshold would you want to reach before you make that call?
Yeah, and I think the difficulty there is this year, it seems like we're doing everything possible, even risking people's health in order to keep classrooms face-to-face. Last year, we were probably in some situations maybe a little too quick to move online, but at the same point, there wasn't a lot of information about the virus at that point, and we knew that vaccines weren't readily available back then. So we were, kind of doing a bit of knee-jerk reaction to try to make sure that we were being proactive. This year, where many people are vaccinated, we know that in our schools, some members many students aren't vaccinated, especially that under 11 age group that aren't eligible for vaccinations. So yeah, it's still a difficult decision to make, but at the same point, it has to be made. And we can't have situations, like I say, the quality of education, teachers are working themselves ragged to try to meet the needs of students who are in the classroom and students who are at home, and it's not sustainable. So what we're doing now isn't working, and in some situations we should be calling it and saying we need to move online. And I know in Regina and in I believe Prairie Valley, a few school divisions have made moves of classrooms to online, and that's good. But like I say, it seems like health this year almost has different instructions from government to delay the decision to move online at all costs. And that's frustrating when we have members calling saying, I know that there are 3 or 4 students in my classroom who have COVID, but for some reason we're still meeting face-to-face, even though half the class is now staying at home because of concerns, because their parents know that they were either close contacts or that they have COVID.
If I could quickly jump in with another one I had, just when you look at the call for the response planning team to return, how important of a role does that play in getting that information to know where that threshold is of when to take classrooms or even entire schools online, based on the information from those?
Yeah, and I think that's critical, that getting that response planning team up and running again gives us the ability to communicate directly with government and directly with health. And it gives health and government the ability to communicate with us. And we have communication channels with our members, and our members, in many situations, trust information that comes from us. And if we can communicate it to them, then they feel a lot more confident in the decisions that are being made. So it really is really important, especially in a crisis like COVID, that we're seen to be collaborative and that we actually are authentically collaborative. The RPT gave that ability, and without it, now we end up being in a situation of being reactive and hearing from members that that their situation is unsustainable and untenable, and having to, wait in line to discuss it with government. The RPT gave us regular placeholder events that we could ask questions and receive information. So it really, can't be overstated how important that RPT is to us. Marcia, do you want to try again with your sound?
Can you guys hear me now?
Oh, there we go. Yeah.
Awesome.
Yeah.
Hi there. I'm sorry, I was scrambling a little bit and I'm not sure whether this question has been asked, but in the document that was sent a little bit earlier, you guys spoke of inconsistent approaches, especially to declaring outbreaks. Can you tell us a little bit what those inconsistencies are?
Yeah, and I think in part some of that might be due to the delays in contact tracing and the delays in information that is in part caused by an overwhelming of our health system. It doesn't seem like the same resources are being dedicated to health, especially to contact tracing. But so we have situations where, parents are getting a test result and they're calling the school saying that their student will be out due to COVID. And yet the school doesn't have that information yet. And so there's lots of inconsistencies and delays in receiving information at the school level, and that's where COVID is wreaking havoc. That's where we need to have that information in order to keep both the school staff safe and to keep the other students safe. And as quick as we can find out who has tested positive for COVID, or then we can start, figuring out who are close contacts and that. But again, that isn't something that should be falling on school staff to be doing. The amount of work that goes into contact tracing, and we're hearing stories of principals and vice principals spending, virtually their entire weekend phoning close contacts of students who have COVID, and that's just not what they signed up for. And especially knowing how difficult school situations are right now, staff need a break, and they shouldn't be expected to have additional items added onto their plate. So yeah, I think mostly it's in part due to the overwhelming of the health system that is causing an spilling over into the school communities and making our school staffs end up doing even more, and then also creating unsafe situations where there are delays in contact tracing and delays in announcing who's COVID positive.
Right, and I have a follow-up question. So the document also mentioned that some schools have moved online, but there seems to be a reluctance to do so. Can you tell me how many schools have moved online so far, and what is the reasoning for not considering this option by the Ministry of Education?
Yeah, and I think that's another issue with not having the response planning team, which gave us those kind of regular placeholder meetings that we could receive information directly from the ministry, both the ministries of education and health, and share that with the wider education sector leadership. So when we don't know how many schools, and it seems like the government site in some cases is a few weeks behind announcing where outbreaks are. And in some cases, they seem to not even be reporting at all, but we still don't get to know which, in timely fashion, which schools, which classrooms were shut down. And again, like last year, it seemed like there was a more proactive move to closing entire schools or closing, classrooms quickly when there's an outbreak declared. And currently, this year, it seems like it's keep open at all costs. And yet it's at the same point, it's the same, health officials that are giving advice. So it makes you wonder if they've received different directions or why they're so reluctant to close a school or close a classroom when there's an outbreak in that classroom.
question for you. You spoke about, as well as the lack of substitute teachers, the pool is growing smaller and smaller. Can you talk a little bit about what the difficulties are right now in the schools to find, substitute teachers to take over, especially now that teachers are also acting as contact tracers?
Well, and so one area that school divisions used to rely on and often quite heavily on is retired teachers in order to fulfill the role of a substitute teacher. And many retired teachers who are often, of course, due to their retirement status, a little bit elderly, they don't want to come into schools and risk their health at a time when they're, potentially should be enjoying their retirement. And so I think the numbers of retired teachers signing up to be substitute teachers has dwindled, and that's also a kind of a litmus test or a measure of how safe they feel our schools are. And so that's what we're hearing, is that members aren't feeling safe in their schools. And of course, from a substitute teacher perspective, why would you risk going into a situation that is going to cause you to be sick and lose a bunch of work anyways? So I think that's one factor. But we know that there are traditionally harder to fill areas in our subject areas and that, but at the same point, there's, there is a shortage of substitute teachers, and that's, just makes the situation even worse, because that causes classrooms to have to be put together, or if there's no substitute teacher in the room, or it causes in-school administrators to have to try to cover, and then they end their day and have to do all of their administrative work after hours when because they've been assigned themselves to cover a shortage of a substitute teacher. So yeah, substitute teacher shortages are adding to the strain of an already exhausted school sector.
Thank you.
I don't see any more questions, but anyone from the media, of course, you can contact me afterwards or later if you have any follow-up questions or need any further explanation or anything. But outside of that, I really appreciate you joining us today, and look forward to things getting better in our education system. Thanks.